I want to talk about something that my friend Claire touched upon today. She talked about the DSM-5 coming out, and they're talking about somatoform symptom disorder, or somatic symptom disorder. Yeah, that's what it's called. Um, Basically, what this disorder is in the DSM-5 is a way for doctors to not waste time on patients who may be hypochondriac or who may have a depressive or anxiety disorder that is affecting them physically. And while as somebody who wanted to be a psychologist, I wanted to go to school for clinical psychology and I wanted to be a counselor and things like that. Like, I can understand that. The way that they went about it was really weird. And Claire touched upon that, and I'm going to go ahead and read the new DSM's definition of somatic symptom disorder, and you tell me how you feel about this. People can be diagnosed with somatic symptom disorder if, for at least 6 months, they've had one or more symptoms that are distressing and or disruptive to their daily life, and if they've had one of the following three reactions. One of the following three. I'm going to go ahead and point that out. Not all three, not 2 out of 3, one of the following three. Criteria 1. Disproportionate thoughts about the seriousness of their symptoms. Criteria 2. A high level of anxiety about their symptoms or health. Or, criteria 3, devoting excessive time and energy to their symptoms or health concerns. This is distressing to me as somebody with Lyme disease, but it's also distressing to me as somebody who was a student of psychology who wanted to go in the medical field. Now, I'm going to go ahead and just link to my friend Claire's video because she goes into it a lot from the perspective of the sick people. And I'm going to link to this article because it goes into it a lot from the perspective of, I guess, the legal side of things. They voted this in December 3rd, 2012. The DSM-5 is going into print. There's nothing that we can do about it now. But the problem with it, it's not that current doctors are going to look at the new criteria and go, oh, well, I'm just going to change everything that I've been doing. The doctors that are being trained are going to be given this manual, required to buy it or whatever. They're going to have to use it. They're going to look it up for case studies, and they're going to have to argue with these criteria. They're going to have to use these criteria in their arguments, in their diagnoses, in their papers, in their assignments. Their teachers are going to require them to argue for or against diagnoses, and if they don't support them well enough, they will fail. They have to use these books as criteria. This book is the freaking Bible of diagnostic statistical manuals. I mean, any statistical manual for diagnoses, this is the one that everybody turns to. Medical doctors and mental doctors, all of them. In psychology undergraduate, we had to argue our cases for either diagnosing somebody with something or not diagnosing them with something. Or if somebody was diagnosed with a condition, we had to argue why they should or should not have been diagnosed with that condition. We had to use the DSM-4 for this, and if we did not successfully argue our point, we failed the assignment. That's how important this is for people in school studying to be doctors, studying to be psychiatrists, psychologists, counselors, teachers even, therapists. Anybody who uses the DSM will go through this in school. If if their program is worth anything, they will go through it. They will have a copy of the DSM in their office. They will refer to it for their patients. And if they are taught that this thing is the Bible, then the new crop of doctors that are coming out are the ones that we need to worry about. So here's what I would do if I was you. I'm not a lawyer. I'm not a doctor. I'm not anybody whose professional advice you should take and then argue in a court of law that, hey, she told me this, so go prosecute her. Okay? Don't come after me for this. This is my opinion. If you have a good doctor that you can trust, that you feel like you can communicate with, hold on to that doctor. If you don't feel like you have a doctor that you can communicate with, somebody that you can trust, someone that you can come to with your issues, no matter how weird they sound, and say, look, I just want to run this by you, can you talk me through it, because I have no idea what's going on, and they take you seriously and they listen to you, you need to find one pronto, because there are going to be newer doctors coming out who may not mind the new, I'm just going to go ahead and use the Obamacare nomenclature for this, but they may not mind the system of Obamacare because a lot of the older doctors are going to be leaving because of that. So you might get stuck with a newer doctor, but hopefully you won't. And if you can find somebody that will listen to you, who has been in the game for a while, who knows to look for things rather than just depending on books entirely, then you'll be in good hands. If you do happen to find a new doctor who still has the bright-eyed, bushy-tailed thing, you might be able to get them to help you by actually influencing them a little bit in the beginning. You might be able to help them to form the opinion that, hey, maybe I should listen to my patients. There are ways that we can help and that we can influence what happens as a result of this really horrible situation. But we just have to be calm about it. We have to stay calm. We have to realize that while this book has been developed by doctors, this is a very small group of doctors. It's a very closed group of doctors. They do not do outside review for this book. It's like, a meeting of one group of people. They're in their box, and they don't come out again until after everything is finished. And once it's been released, what they're going to do, when people argue with them, they say, you know what, we conferred with each other and we all agree, so you guys can just go, like, jump off a cliff or whatever. So we need to remain calm, and we need to just do what we can to ensure that we're still getting the level of care that we deserve and that we're paying for. So I'm not panicking about this. It upsets me quite a bit. It upsets me because of my background. It upsets me because of my intentions that I had for myself and for my career. I wanted to help people. And the thing that I think that a lot of people need to keep in mind is that a lot of people who go into medicine are going into medicine to help people. They're not going into it for the money or for fame or whatever. And if you find a doctor who immediately, like, upon finding something weird about you is like, ooh, I'm going to write this up, you need to find a new doctor, because they're not in it for you. They're in it for them. So yes, they have to do CYA tactics. They have to figure out ways to, not get themselves into trouble while also being able to help you. But if you can find somebody that you can work with, that's like the most valuable patient-doctor relationship ever. And that's what's important here. The DSM-V will probably be around for another decade. The DSM-4, I think, was first approved in 1994. It's 2013, and they're just releasing it. Yeah, 2 decades? That's quite a bit of time to have one manual, and it wasn't perfect, and they did fix a few things that I do agree with in the DSM-5, but they made far more changes that were just absolutely ridiculous. But we just need to keep in mind that the people who are following this manual also do have some common sense. They are human beings. They're not robots, and while it's worrisome that our school system is the teach from the book, do or die kind of mentality, you're not going to find that all doctors have that mentality. You just have to find a good doctor. So everybody who has a chronic condition, who is having a situation where you may not quite know what's going on yet and you're working on it, just have faith, and in whatever it is you have faith in. I don't necessarily mean religious faith. I just mean have faith, have hope, find someone you can work with, and be serious about your patient rights. Be serious about how you speak to them, and be respectful, because at the end of the day, that's who's making your decisions for you, is that doctor. And whether they choose to use the DSM-5 or they choose to use the DSM-4 or they choose to just use them as general guidelines, a good rapport with your doctor is always the best way to go. That's the best way to get what you need. And that's my take on it. I'm trying not to be like a nervous Nelly or, Debbie Downer or anything about it. What's done is done. We can't change it. But what we can do is we can work with it, and we can address things as they come up so that we're ready. And we need to be ready. We need to educate ourselves. And I'm going to be including all these links, in the description so that you can read them for yourself and see what I'm talking about and prepare yourself for a time where perhaps we're not going to be taken as seriously, but we can stay calm and do what we got to do. That needs to happen, and that's the only way we're going to get through this. And I hope everybody has a good week, and I will be back with more news and more updates as they happen, whether in my personal life or in the news of medicine or school or whatever. So that's it. That's all I got. So I will talk to everybody soon, and have a great week.